Thank you for joining us today for how a 5-pound weight loss across your population reduces disease risk and healthcare costs. I'm Cara Tarantino, Vice President of Marketing for Orthus Health. I'm here today with one of our professional health coaches, Dawn Cuck, an exercise physiologist with extensive experience coaching individuals with comorbidities to successful long-term weight loss and maintenance. Today, we'll share insights about weight as a modifiable risk factor for chronic disease and its significance on our growing healthcare costs as employers and other bearers of risk. We view weight loss as your investment in your employees and your organization. Lost pounds are like money in the bank, and we take the long view from the beginning. We plan to share also the benefits of an effective employer-sponsored weight loss program. We'll outline the Orthus Health First 5 weight loss program and show you the meaningful impact of a 5-pound weight loss across your population. We'll discuss how weight affects other risk factors, how it changes disease onset risk and progression, and most importantly, share with you how and why employers are paying dearly for it. We'll address the results delivered, how the results delivered by your wellness and well-being program are dependent on weight loss, no matter what other successes you may have achieved with your population. If you have limited success with wellness, it could be because of the inability of your employees to lose weight and keep it off, or perhaps due to the lack of effectively addressing the problem of increasing obesity. Dawn will share her experience with members she coaches and what's important in getting employees on board quickly and permanently in losing weight. We'll look at the digital tools, resources, and support you'll need to make your weight loss program work. And we'll share how we stack up against the top weight loss competitors. First, just a little background on Orthus Health. We are pioneering new pathways for population health with the goal of improving the overall employee experience. What that really means is we create unique pathways or roadmaps to change for every individual based on the data we gather and analyze from our Know Your Number disease risk tracker, biometrics, medical and pharmacy claims, and population health management reporting. We do have a comprehensive wellness solution, as you know, but it's in our ability to direct individuals along a path created uniquely for them and get quantifiable results that sets us apart. As we affect positive change and personal growth, we elevate the overall employee experience and actually help improve the relationship employees have with their employers. Developing a unique and personalized pathway to improved health for each individual involves an understanding of risk. You're most likely familiar with health risk assessments, or HRAs, but may not be as familiar with disease risk trackers. Both are questionnaires regarding lifestyle behaviors that are often paired with biometric screening results to produce a report on health risk and provide some sort of risk score. Most standard HRAs are statistically based and provide a good enough assessment of health risk. But a survey of large self-funded employers revealed that 50% think they're a waste of time and money and are skeptical about whether or not employees are actually truthful in answering. Disease risk trackers, specifically the Know Your Number risk tracker, is a scientifically proven model that identifies an individual's risk for 6 chronic diseases, pinpoints modifiable risk factors, and how each of those factors contributes appropriately and individually to each chronic disease. It assesses risk according to peer group, and when combined with biometrics, gives an overall disease risk score. So Know Your Number is based on a predictive model called synthesis analysis, or predictive technology, that has outperformed the original Framingham risk score model because in part of its ability to include new risk factors that were unknown when the Framingham heart study began in 1948. Why is this important to our efforts at pinpointing risk in our discussion today? I'm going to give you an example. Let's say we have 15 risk factors for chronic diseases that are already included in our risk model. We know what they are: weight, exercise, blood pressure, etc. So hypothetically speaking, if peer-reviewed medical journals report this year on research that has been done proving there's a correlation between having long wavy hair and an increased risk for heart disease, we can add hair type to our disease risk tracking model. It's exactly what happened over the years when exercise, among others, was discovered to be a risk factor for many chronic illnesses. Exercise was incorporated into the risk prediction model. If hair type, color, length proves to be a significant contributor to a person knowing whether they are at risk of developing a disease, wouldn't you want that to be part of your screening tool? In developing a unique pathway to change for each individual, we would want our model to report that cutting your hair would help improve your overall health risk. This may be a silly example, but then again, we don't know what we will uncover tomorrow. But the point is, you don't want to ever be using an outdated model, as this would make the risk projection inaccurate and thus the cost projections. When an employer or broker tells me that an HRA is good enough, we have evidence to support the fact that it really isn't, and we need to use available tools that are not only precise, but also current and scalable. Weight is a risk factor in our model, so we can accurately pinpoint just how much being overweight or obese contributes to the risk for disease. And because we know which diseases it affects and by how much, we can also determine the impact of even subtle changes. The correlation between obesity and comorbid conditions comes as no surprise to any of us, but the sheer number of chronic conditions that it impacts is pretty astounding. What may also surprise you is the reverse, the extent to which positive change can occur with weight loss. However, the level of support and losing weight does make a difference. In a look-ahead study, AHEAD, which stands for Action for Health Diabetes, the data pointed to the difference between intensive lifestyle intervention versus usual support and education. The intensive group lost 8.6% body weight compared to just 0.7% in the supportive group. And those with type 2 diabetes in the intensive intervention group saw clinically significant weight loss. Of note also is when people in the intensive group lost weight, they gained better control over diabetes, had a reduction in cardiovascular disease risk factors, and also improved their medication compliance. When we consider how weight loss impacts our population, it's important for us to be able to track and measure the effect, not only on the condition itself, but also evaluate how weight loss impacts other risk factors as well as behavior change, such as losing weight having a positive effect on a person's ability to also be compliant with taking medication, for example. Our reality today is almost 40% of adults in the US are obese. I know you're thinking, tell me something I don't already know, but I wanted to call out a couple of challenges with regards to this statistics. In an October 31st article in the journal Obesity, a survey reported only 50% of individuals who are obese actually even see themselves as obese. That in and of itself is a challenge. And as we promote primary care to increase prevention and reduce ER use, we learn that only 28% of healthcare providers even see it as their job to counsel on weight loss, a very low percentage. So if we're thinking primary care is a catch-all for the issues that plague employee health, we need to think again. Our medical schools don't train physicians to be weight loss counselors. Also of note is that only 17% of employees even see employer-sponsored plans as helping with weight loss. Together, there's a lot of opportunity here to put sustainable programs in place that work. A 5-pound weight loss can and will make a difference, as I'm going to point out shortly. And for individuals to lose 5 pounds and keep it off, as we know, there's a number of program components that you need to be prepared to offer. First, you'll need your own employer-sponsored program that's HIPAA compliant and uses data-driven coach outreach. As we saw in the previous slides, we can't look at weight loss just to feel and look good. We need the professional support so we can offer any weight loss program in tandem with other health management programs, such as prediabetes, prehypertension, cholesterol and stress management, even injury prevention and safety. We want employees to be able to be on more than one program at at a time if necessary. So the programs need to work hand in hand with weight loss, and these are especially important for those with comorbidities. The data we identify through Know Your Number and biometrics points to which employees should be on which programs. Employee communications are important, and at Orthis Health, we routinely provide hours in English and Spanish, including weekly health tips and more in-depth campaigns to encourage participation. I'll show you briefly later as well. And you need options. An effective weight loss program can work well or should work well as a standalone service, as well as integrate naturally with your wellness and well-being initiatives already in place. For those of you who are resellers or interested in becoming a reseller, you may want to private label our weight loss program and resell it to local employers. So that's another option. Population health report should show you the progress of your population on any type of weight loss program. What's working, what isn't, and point to where your disease risks due to overweight and obesity make you financially vulnerable. Employees need to receive their own personalized reports with recommendations as to how they should take action based on their unique risk profile. When you look at available weight loss programs, you'll want to ask about the type of reporting that's available for both individuals and the population. You'll want to know also what types of reports are uniquely available for these audiences, but also how often you can get those reports and who delivers them, and how they're communicated to you. So I'd like to pause here, since I've been talking enough, and turn our attention to some Q&A with Dawn, who's going to give us special insight into why we focus so much on the first 5 pounds, specifically in our first 5 weight loss program. So Dawn, why focus on only 5 pounds in the first 6 sessions, and why are the results so effective?
Well, thank you, Kara, and hello, everyone. So it's focusing on just a short-term goal, such as the first 5 pounds, it's not as overwhelming for someone as focusing on a long-term goal, like losing 30 or more pounds. So once the individual sees that 5 pounds is possible, their motivation increases, their confidence increases, and this really opens the door to a longer-term commitment to weight loss and to their success.
What are the top 3 things that actually impact a member's success on First 5?
Okay, well, first, and in my opinion most important, is finding their own motivation for weight loss. Basically, the why it's important. You know, why is it important to them? We have a campaign here called I Promise 5, which helps them pledge this 5-pound weight loss for themselves and gives them permission to put themselves first. And this can be very helpful. Then, secondly, keeping it simple. And this means just focusing on 1 or 2 things at a time so as to not overwhelm the individual. And then lastly, creating an environment for awareness and mindful eating. And this usually involves some sort of tracking, you know, but we allow them to do whatever works for them. You know, if they're comfortable with technology, you know, we allow them to use whatever technology they're comfortable with, or if they're more of a paper and pencil kind of person, then, you know, they can track with paper and pencil. But this tracking creates awareness, which is very helpful.
Dawn, I know people today are going to be looking at different options. There's so many programs to choose from today. So how does First 5 compare to other successful programs like Weight Watchers?
Okay. Well, I find that successful weight loss programs have a few things in common. One is some sort of support. In our support, we provide our health coaches. Also accountability, such as reporting in their progress to someone. That's important, as some individuals are motivated. I had someone tell me that they didn't want to let me down. They didn't want to let their health coach down. And finally, as I said before, some form of tracking. And Weight Watchers uses points. You know, the 21-day fix tracks servings and serving sizes, but there's always some sort of tracking involved. And again, while we don't require tracking, we provide multiple resources based on the member's accessibility to technology and comfort level to be able to track in many different ways. We also include online program materials such as a program guide, a body measurement chart, a meal planner, food log and hunger scale, and much more. And these tools help the members think differently about weight loss. Our new First 5 in a Box program takes it even further and allows us to deliver things like a smart scale or a fitness device and tape measure to the individual's doorstep, which gives them even more tools to empower them for their long-term weight loss goals and or maintenance if they've hit their goal. And it helps us as health coaches provide even more personalized and meaningful support. So I'd say those things that are common are the tracking and the support. So that's all.
Can you explain a little about how employers are incentivizing employees to participate?
Well, sure. I'll just give a couple of examples. There's an infinite number of ways that people can incentivize, but some employers have provided First 5 as a reasonable alternative to meeting a specific program goal. What that means is if there was a goal in order to earn a discount or something like that, and the individual did not meet it, then they're provided a reasonable alternative to still earn that goal. And that, if they didn't meet their BMI or weight goal, completing the First 5 program with their health coach can be used. Others simply provide it as a resource to assist members in meeting their own personal goals. Maybe they have an outcomes-based program. For example, an outcomes-based program might require members to achieve a specific reduction in BMI or weight loss from year to year. But, so First 5 is used as a resource to their employees to be able to meet their goals or any personal goals. And then we've also had employers in the past offer things like gift cards for completing the program and actually losing the 5 pounds. However, in the more recent past, we've seen employers react to their employees losing 5 pounds a little more seriously. Everyone appreciates a great, gift card, but it can also provide the appearance of, making 5 pounds weight loss seem trivial, and we really know that it's not trivial. So now employers are starting to see the significance of these first 5 pounds, and especially the benefits for the individual, and also for the employer when the employees can actually keep off this weight or even continue to lose weight and develop healthy, lifelong lifestyle changes.
Great, Dawn. Thank you for sharing your perspective as a health coach. We appreciate it.
Oh, my pleasure.
Just a little bit of information on the First 5 program to expand briefly on what Dawn said. Members can view their data on the wellness portal and app and access other online tools and resources in addition to the program materials such as sedentary disruption challenges, fitness device integration, health trackers, goal setting tool, newsletters. And First 5 in a Box starts out with a concentration on 5 pounds with behavior modifications in 6 sessions. but it's a longer-term program, typically 6 months and beyond. Once employees have completed the initial program, they can opt in for extended coaching support, which includes telephonic support, online messaging, mobile chat. So it's possible to start with this short 6-session program and then, of course, purchase equipment later for those that want to continue with a longer-term program and support. And as Dawn mentioned, just wanted to give you a little visual here. The program materials you see are available online for both of the programs. The coaches work with members in using these materials effectively to help them stay on track and then monitor their progress. So the In-A-Box program contains a Fitbit fitness device, smart scale and tape measure, and as Dawn said, we ship it directly to members, and we use that because that's what our wellness portal is compatible with, among a host of other fitness devices. So all member data from the device, in addition to the risk scores and biometrics, are available for members to see. And this just gives you an idea of some of the sample topics from the first 6 sessions. Sometimes this is the first time a member has been on a coach-driven weight loss program that's all about their goals. So the guidance is critical to understanding the program and getting members on board quickly with what they need to do. As you know, we need to get people to participate first before we can engage them and then sustain them in these really important programs. I wanted to show you results from 2 different types of employers whose employees were on First 5. One is a national convenience store chain and the other a food service distribution company. Both have diverse populations, including those on their feet all day serving customers, truckers, sedentary and remote workers. Nearly 700 employees from these 2 companies completed First 5. The goal, of course, was 5 pounds in 6 sessions or 6 weeks. In both cases, employees were incentivized to participate, and both companies exceeded their goals, averaging almost 6.5 pounds per person, with an average completion rate of 62% and 75% respectively for those who completed the program and lost weight. I'd like to point out also the exceptional results from our convenience store employer who averaged almost 10.5 pounds loss per employee. 15 of the employees who completed the program moved down a level of obesity. 7 moved out of the obese category completely, and 1 person lost enough weight to be at a normal weight as a result of continuing with extended coaching support. 92% of those who completed the program opted in for the extended program, where they connected with their health coach once a month. Pretty powerful results. And I'll also add here that this was a client that we really had a tough time with engaging people initially in just a standard coach outreach program. Once we were able to create those unique pathways to weight loss and combine them with addressing their other comorbidities, we saw greater results and really better participation from the get-go once that change was made. So also wanted to share some other insightful information from this employer about the impact of coaching on member engagement and the effect on the weight loss claims. So in our first example here, the member had a diagnosis of diabetes and weight. Claims for the first year was over $123,000. The member was identified as having a high readiness to change index or a high level of motivation, which certainly helped them. The coach described the member as overweight with an elevated blood sugar level. Member was concerned about not being able to exercise due to back surgery. They discussed nutrition, challenges, and barriers to weight loss with their coach, and since surgery, they reported a 25-pound weight loss. The result, claims were projected to decrease by over $79,000 the following year. This de-identified information is important for us to share with you to understand how a personalized program and attention directly impacts costs. Since we cannot approach weight loss in a vacuum, I wanted to show you another example of a member who's been diagnosed with degenerative ortho disease. Their motivation level was about average, and they had been working with their coach for over a year. In that year, they lost 25 pounds, blood sugars and blood pressure both dropped. As a result, their claims for the following year were expected to drop by over 20,000. We look at the numbers by evaluating the programs pre and post, by doing baseline and follow-up, know your number assessments with biometrics. Then we further predict the impact of lifestyle change and risk modification on costs. Data-driven weight loss is what separates First 5 from most other programs. It's the combination of these 4 elements, the know your number, disease risk tracking, biometrics claims, and action in the form of the member being matched with the right intervention and support that's so critical to delivering results. We have the disease risk trackers and reports, screening results, and claims platform where we can monitor trends and ask questions of our data. So with these tools, we can measure, as I said, before and after the intervention and see how the changes in costs stack up against the investment made in the program in the first place. We deliver and discuss data confidentially with each employee, yet we're transparent in our ability to deliver quantifiable results for employers. And the foundation for our data-driven weight loss is our 2 HIPAA-compliant portals that house all the member data. Members access their wellness portal or app to view their screening results along with their history, risk score, program materials, etc. Here they also communicate securely with their health coach who can see all the member data, including medications taken and claims on the back office coaching platform. This data analytics is now completely integrated with our platform, and this we call our comprehensive health management system. The portals talk to each other seamlessly, so over time, coaches can manage all new screening information, claims data, they can help members get back on track, and we can also include any other data that we want to add in the future and track via the platform. So it's really important to mention again that the model is flexible and scalable. So as we uncover the new risk factors, new data, and deal with increasingly diverse populations and so many different levels of participation and engagement, we can easily grow and scale accordingly. So we discussed the difference between a disease risk tracker and an HRA earlier. Knowing how to use data effectively is a people strategy, and data is only effective when it's used. So as we know, weight's a modifiable risk factor and it contributes to our risk for disease, but it also contributes to other risk factors. As an employee, you might want to ask certain questions of your own data, such as, if I get my weight down to normal ranges, how will that impact my blood sugar levels, and how does that change my risk for developing diabetes? As an employer, you would want to know, if all my employees reduce their weight by 10%, how would that weight loss impact their blood pressure as well as their risk for developing congestive heart disease, and how? And of course, how does that 10% drop in weight impact my healthcare costs in the next 5 years? We can answer those questions for today and accurately predict those answers for tomorrow. We need to know what can happen when we make lifestyle changes and what will almost surely happen if we don't. Each one of us needs to know our own personal disease risk tracker score, along with all the data that goes into making up this number. So we need to know what we can modify that will cause a change in our risk score. We need to be able to understand what that means too. And we need to know what will happen if we get all of our modifiable risk factors within normal ranges. We need to see in black and white how responsive the small incremental changes we make in health can change our risk score. So in other words, the risk score needs to be highly responsive to hold our attention, keep us motivated to finish a program, and to stay on track with new positive habits following the program completion as well. Everyone needs their own personalized action plan, or what we call a pathway to change, and so does Joe. Our buddy Joe here is healthy but obese, and even Joe Though Joe has normal blood pressure and normal cholesterol, his cost to society is about $36,000 based on recent studies. That figure is really based on age and gender. His struggle affects everyone, and it impacts all of our health premiums, among others. Joe's engagement with his health also impacts your success as an employer. He needs to be accountable for his own health, but he can only do that with a clear and relevant action plan. So having the disease risk tracking information that clearly displays Joe's biometric risk factors and his overall risk for disease, modifiable risk, and age gender comparisons, that's really when the reality sets in, especially for younger employees who may think they're pretty healthy until they see their risk score compared to their peers instead of to those in the older generation. You'll also want to keep an eye on the risk movement of your population and how the risk movement affects claims costs. You'll want to know what your employees have the power to change to avoid new disease onset and what costs you can expect to pay if they don't change, or what you can save if they do. So we provide the comprehensive program reporting so you can aggregately see how the weight reduction or increase directly affects your projected healthcare risk and costs. So over the next couple of slides, with that background information, we'll show you how a 5-pound weight loss across the population affects chronic disease onset and costs. So imagine a world where everyone loses just 5 pounds and doesn't gain it back. 5 pounds may not seem like much, but the impact of even a small reduction in weight is powerful. To illustrate our point, we ran an analysis using Know Your Number on one of our clients with an employee population of over 14,000 and projected how a 5-pound weight reduction with all other risk factors except weight held constant would affect new cases of chronic disease onset and related costs. So at the time of the baseline screening, which included the biometrics, 44% of this population was obese. With a 5-pound weight loss, the number of obese individuals dropped to 40% of the total population in the follow-up screening. So this was a 10% decrease in the number of obese individuals. So this is where it starts to get interesting. Here we see the number of new cases of disease that can be avoided within the next 5 years with the 5-pound weight loss. If you look at diabetes, the area of the most significant change highlighted in yellow, you'll see that at baseline, prior to any weight loss, there are over 700 new cases of diabetes projected in the population. Based on the data, 611 of those projected new cases can be avoided with lifestyle modification. If our population loses just 5 pounds, the number of new cases projected drops from 700 to 641. And of those, 641 are now avoidable instead of the 611, a difference of 11%. As you look at the other diseases, congestive heart failure, disease, stroke, you'll see that there will be fewer new cases of those diseases as well. A total of a 9% decrease in new cases of disease onset across the population with just this small weight loss. When new cases of disease can be avoided, this translates to cost savings and the ability to avoid future costs from disease burden. The 11% reduction in the number of avoidable cases of diabetes as per a follow-up screening accounts for over $2.2 million difference in projected costs. When we look at how this 5-pound weight loss impacts each of the diseases that can be avoided across the population, it amounts to over $3 million in projected savings. So just to summarize the significance of the small weight loss, so we have 14,400 employees lose 5 pounds, all other risk factors constant, can collectively decrease the number of new cases of disease onset by 9%. So the light bulb goes on now when we begin to realize that 5 pounds we can avoid spending over $3 million. Imagine what the potential is for disease and cost avoidance with even greater weight loss. So additionally, it's really interesting to see how this 5-pound weight loss impacts our risk movers. 10% of our population that was in the extremely high risk group moved down a level to the high risk group, accounting for 1,400 employees. Over 13% of those in the high risk category moved down to the borderline high, and so on. It's this movement of risk where we begin to see that the programs we're implementing and are working, and know that cost reduction in claims will soon follow. In follow-up to this presentation, I'm happy to share the complete report so you can examine in more detail the impact of what weight loss can do. Of note also, if any of you have gone to our website to request an age-gender report on your own population, it's located from our main bar under Resources, and you drop down and click on Age-Gender Report. You have what is forecasted for your population based on the NHANES database. If you want to fill out this information, if you haven't done that yet and want to fill it out to get this free age-gender report, provide the information in the box below and then make a note saying you'd also like to see how a 5-pound weight loss can impact your particular population, and we're happy to provide that for free and can send that to you in a couple of days. So as we know, I keep saying this, weight is a risk factor for diabetes, and type 2 diabetes is preventable and manageable. Ideally, we want to halt the progression of prediabetes or reverse type 2 diabetes. Here's one example of how we create a personal pathway for an individual to change risk and impact future costs. The data leads us to implementing the right form of support and intervention. So once we have identified who has prediabetes, we look at all the modifiable risk factors, weight and waist circumference among others. We look at the costs of prediabetes versus diabetes and determine the right interventions based on the individual's personal health, disease risk profile, and all the other outlying factors that go into that as well. The personalized intervention would include first 5 to ensure the individual has the direction and the support that they need. Coaches work with the individual to ensure program adherence and can adjust or make recommendations for other programs, again, based on the individual's progress and the ability to complete the program. With behavior change, as well as adhering to the program and closing any gaps in care, we can effectively alter an employee's personal path and establish newer ones that give them additional opportunities to make other important lifestyle changes. Because it's so important, we have the ability to develop these personal pathways to change for every individual. I wanted to show you another example, this time with a different data source, a little different path. This pathway is for an individual with diabetes and medication compliance issues. So in this example, we want to ensure that the person with diabetes adheres to evidence-based rules for taking medication, as per their physician, and because the science tells us it works. We pinpoint the care gaps, an intervention with incentive is provided, and the health coach works with the individual to support the physician and the clinical care team. Once the medication compliance is achieved, we close the care gap and effectively alter the personal pathway. When you look at your goals for your wellness program or any other interventions you're offering employees, see if there is a clear pathway to change. See if each step along the way can be addressed to get the results you expect. While there are many elements that go into this pathway, it's helpful if you can get the plan, the support tools, reports, and recommendations in one source. Talking about weight and the need to lose weight is a highly sensitive topic. I truly believe that a person's relationship with food and their weight is as personal and intimate as their relationship with their spouse, child, parent. And when dealing with sensitive topics, we need to have communications that hold individuals accountable, inspire and motivate, yet recognize the nature of such a highly emotional topic. There are many wins for an individual and employers in losing weight, changing size and behavior, and we need to lead with what's in it for the individual first and how it can really change their quality of life. With that, we recognize it sometimes takes a village to help people lose weight and sustain weight loss. And the support can come in many forms, from coaches, family, community, social media, colleagues, and more. We also recognize there are many saboteurs out there in many forms, and we need to succeed collectively in spite of those pitfalls. We've developed a communications program called I Promise 5 that Dawn mentioned, a campaign we can customize for your own employees. It's an opt-in approach where employees promise to complete the initial program in 6 sessions, lose 5 pounds, and keep it off for good. It can be done privately, so people decide on their own to participate, or it can be done by department or team, where each individual signs a form to agree to a new weight set point that's 5 pounds less from where they are today. As people access the program at different times, you'll always have new people taking on the promise and others who are finishing the program and commit to keeping it off, who can be cheerleaders and weight loss leaders. It's a great collaborative campaign where support, tips, recipes, lessons learned, and more can be shared. Other communications involve messages that we create and customize for your organization. You can email or post to social media or print out and hang in a break room. We have one client that focuses on specific messages each month, and we've developed tailored communications to support their focus and efforts. One month they wanted messages to help educate on the difference between good carbs versus bad. Another was effectively maintaining weight without gaining. Here's just another example to show how we routinely create these messages in both English and Spanish, and all with a focus on taking action. Just last week is the 2018 U.S. News and World Report Top Weight Loss Diets. I thought it would be interesting to see how we stack up based on this list. Here are the top 4 best weight loss diets, and they're all different. Weight Watchers is #1, and it's also, I think, 4th on the list of the overall best diets. And the Personal Total Access Program with coaching support is the closest program to first 5. You work with a dedicated health coach who has lost weight on the Weight Watchers program, who has taken a course. They're not professional coaches, so they can't assist with comorbidities and the impact of weight on other diseases. They don't have access to personal data. Employers don't see reports on the success of the program or lack thereof. Other programs like Jenny Craig at #2 have coaches who have been trained by taking a Jenny Craig course. And if you're familiar with Jenny Craig, the food can get pricey. There's always the concern about switching over to regular food once you reach your weight loss goal. This year, there are a couple changes in the following programs that were on the list: the Flat Belly Diet and the Nutritarian Diet tied for 3rd. Both have membership fees for online support and are more effective if you read the book. Although very popular these days, the keto or ketogenic diet was ranked as the worst diet, especially with the high emphasis on protein and the risk for those with kidney or liver conditions. So if you want to review just how the first 5 stacks up, please let me know, and I will send you a document written in the same format as the U.S. News Best Diets format. It's a little lengthy, but you can do a side-by-side comparison. And please let us also know if you'd like more information on our pricing, so you can see how we stack up with the side-by-side comparison and benefit as well. So in summary, data-driven weight loss works. When we create more personalized paths to weight loss, health, and wellness, we are better able to engage employees on whole new levels. When employees see their own progress and review their history, they learn to track and measure more consistently, which is a critical component of sustaining long-term weight loss. Today, weight is an issue we hate to deal with at work. It's a touchy topic, too personal, and often too intrusive, but the effects are impacting all of us. So why not get the support your employees need but may never ask for? You can establish your own program, offer incentives, and then get out of the way, except to monitor risk and cost movement and ensure you are offering the right relevant program to keep members on track. A good long-term weight loss initiative built into your wellness program and company culture is surely worth your investment. So with this new year, attention is again centered on losing weight. So why not start sooner than later, and let's get this done together. So I'm always thrilled when we can end early before the hour. I thank you for your time today and applaud you for taking the first steps in finding the right weight loss program for your population. I'd love to hear more about your challenges, answer your questions. So please do not hesitate to reach out as we also look to connect with you further as well. And also of note, there is a handout as part of this program that you can download with a little more detail on the First 5 program. And I will also be sending you your SHRM certificate of course completion by the end of the day today. So thank you so much for attending, and we look forward to talking to you soon. Goodbye.